There's been a massive COVID-19 surge in China, with reports of millions of cases recently. An article suggests that over half of the passengers on two separate flights from China to Italy tested positive. Several countries have put measures in place to vet visitors from China. Let's hear what's being done here at home. Dr. Nicholas Crisp from the Health Department joins me now. Thank you so much, Dr. Crisp, for joining me. Now, of course, this is worrying news for the world in general, and we're also not hearing much from the Chinese government regarding what the actual scenario is in that country. But of course, South Africa, we can't afford to go into another lockdown. What's the Health Department doing to ensure that we as South Africans will be safe, and how are they handling the situation at airports with Chinese arrivals?
Yeah, good afternoon, Darren, and good afternoon to the viewers. Obviously we've been watching how COVID has been progressing in the country and what's happening in other countries. We're well aware of what's been happening in China, and we are aware that they have recently lifted their lockdown restrictions, and so people are moving around. We also know that of the 1.3 billion people in China, many have not been exposed to COVID, either from vaccines or from wild virus infections. So they're in a very different position from ourselves, where we have a very high immunity to particularly the Omicron variant, but to COVID in general, both from vaccination and from wild virus infections. We also monitor the variants and the various strains of those variants. They call them clades, and the various RNA material of the virus is being monitored on a regular basis. As everybody knows, we have a very good laboratory system across the country and across Southern Africa. So we are aware of which variants are in South Africa, and we have already had more than one case that has been detected of the variant that's doing the round in China at the moment. So there are literally hundreds of variants that are circulating in the world, and we have been exposed to most of them in South Africa. So we have seen that many countries, including the United States, several European countries, Malaysia, Japan, Australia, and others in the East, have imposed conditions for their Chinese people moving into the country, where they are requiring tests, requiring wearing of masks and so forth. But there are many countries who have not. So we know Germany, for one, has said that there's no need for routine screening. We have seen views from the European Commission saying this is overreaction and not necessary. We haven't had formal discussions with the WHO yet, but there are many members of the WHO who believe this is not necessary. We are monitoring closely, and we do not believe that it's necessary at this stage to have any further restrictions placed either on people coming in from China, or to change our restrictions or have any restrictions in South Africa at the moment. We obviously encourage people to get vaccinated. The vaccines that we use are still very effective against the various strains that are doing the rounds. And if people feel that they are at risk, they should wear masks, wash hands, as we know that those are protective mechanisms.
Dr. Crisp, of course, as you said, the WHO says there's no reason to be concerned, although they have said that there is some concern that the Chinese governments, they're not being transparent enough about the situation in that country. You also mentioned that the variants in China is also not something to be concerned about, and you also know about the different variants here in South Africa. But of course, I think there is still some level of concern because we don't know 100% what's going on there in China.
Yeah, so we don't know what's going on in many countries in great detail, but we have a sense of what's going on, and we do see reports. I'll leave it to the WHO's discussions with China about exactly what's happening in China. But we know that they've got BF7 as the variant that they are reporting at the moment, and we have seen BF7 in South Africa. There's also, that's a subvariant of Omicron. And what's circulating in the world at the moment, including China, are variants of Omicron. Now, the concern is always that when there are pools of people who have not been vaccinated and are not immune, it provides an environment where the virus can continue to mutate. And as we've learned, this virus mutates quickly and it's unpredictable. So that's why we will monitor very closely what's going on, and we'll meet in the new week to see whether there's any further measures we should be recommending. But for now, we are not panicking.
All right. Thank you so much, Dr. Nicholas Crisp from the Health Department. They're saying there's no reason for concern as of yet regarding the situation in China and the ban on or needing to impose stricter measures on Chinese travelers coming to South Africa, but they will be monitoring the situation very, very closely. Let's go to